What if your home health agency provided weeks of care, only to find out Medicare denied the claim? And now you can't bill the patient? This happens every day, and the reason is simple. The Advance Beneficiary Notice, or ABN, was not issued correctly. Today, I'm going to explain exactly what the ABN is, when it's required, when it's not allowed, and how it protects your agency from financial loss. Let's get into it. What is an ABN? The Advance Beneficiary Notice of Non-Coverage, Form CMS R131, is a written notice given to a Medicare beneficiary when your agency expects Medicare may deny payment for specific home health services. The purpose of the ABN is twofold. First, it informs the patient that Medicare may not pay for certain services. Second, it gives the patient the opportunity to decide whether they want to receive the service and potentially assume financial responsibility. Without a valid ABN, your agency may not be able to bill the patient if Medicare denies the claim. It's important to remember that ABNs apply only to Original Medicare, also known as fee-for-service Medicare. They do not apply to Medicare Advantage plans which follow their own coverage and notification rules. In home health, an ABN is required when services are physician-ordered, but the agency expects Medicare may deny payment because coverage requirements are not met. ABNs cannot be issued routinely or automatically. The provider must have a specific reason to believe Medicare may deny the service before issuing the notice. Most clinicians think ABNs only apply to medical necessity issues, but CMS actually identifies several situations where Medicare may deny services. These include services that are not medically reasonable or necessary, services that are not indicated for the patient's diagnosis or treatment, services considered experimental or investigational, services performed for research purposes, or services that exceed Medicare's frequency limits for a specific diagnosis. The ABN must be issued before the service is provided, not after the visit, not after documentation review, and never after Medicare denies the claim. The patient must receive the notice early enough to make an informed decision. If the ABN is issued late, it is invalid and your agency will be financially liable. The ABN is not just a form, it is a choice. The patient must voluntarily select one of the available options. They can choose to receive services and accept financial responsibility. They can refuse services, or they can request the services and ask that Medicare be billed anyway. You cannot force the patient to sign, and you cannot pre-select an option for them. Agencies must always use the most current CMS-approved version of the ABN form. Using an outdated version may invalidate the notice. The ABN form provides the patient with three options. Option 1 means the patient wants the service and wants the claim submitted to Medicare for a coverage decision. If Medicare denies the claim, the patient may be responsible for payment and has the right to appeal the decision. Option 2 means the patient wants the service but does not want the claim submitted to Medicare. The patient agrees to pay out of pocket and does not have appeal rights. Option 3 means the patient declines the service entirely. No service is provided and no charges occur. The patient must choose the option themselves. Again, staff cannot select it for them. The ABN must be explained to the patient in a way they understand, and the patient must be given enough time to decide which option they want to choose. Another critical requirement is the cost estimate. The ABN form must include a reasonable estimate of the expected cost of services. This estimate should be based on the number of visits and your agency's charges. It cannot be blank, and it cannot say something vague like cost unknown. Leaving the cost estimate blank can invalidate the ABN. Once issued, an ABN generally remains valid as long as the services being provided and the patient's condition remain the same. If circumstances change, a new ABN may be required. The ABN form also includes an additional information section. This area can be used to provide extra clarification to the patient, document additional explanations, or record a witness signature if necessary. This section can also document situations where the patient refuses to sign the form. What happens if the patient refuses to sign? If the patient refuses to sign the ABN, the clinician should document that the notice was explained and that the patient declined to sign. This documentation can be recorded in the additional information section or in the clinical record. There are 3 major times when ABNs are typically required. First, initiation of services. If at start of care, you believe Medicare may not cover services. Second, reduction of services, for example, reducing therapy frequency when goals are met. Third, termination of services. If services are ending due to non-coverage, but the patient wants to continue anyway, the agency is responsible for ensuring the ABN is issued correctly. There are also situations where ABNs cannot be used. An ABN cannot be used to correct administrative or documentation errors. For example, missing face-to-face documentation, missing physician signatures, incomplete certification requirements. In these situations, the agency remains financially responsible. The ABN cannot transfer liability to the patient. Services that do not require ABNs. ABNs are only used when Medicare may deny coverage. They are not used for services Medicare never covers. For example, personal care-only services, custodial care not associated with skilled care. These services do not require ABNs. Dual-eligible patients require ABNs too. Even patients who have both Medicare and Medicaid require ABNs. Medicaid does not automatically pay when Medicare denies a claim. Without an ABN, your agency may not be able to bill the patient. ABNs are not required during emergency or urgent care situations. This rarely applies in home health, but it is important to understand. ABN does not replace HHCCN. Another important distinction is between the ABN and the Home Health Change of Care Notice, or HHCCN. The ABN protects financial liability. The HHCCN informs the patient of changes or termination of services. Both may be required in certain situations. They serve different purposes. What happens if the ABN is invalid? If the ABN is invalid, your agency cannot bill the patient and Medicare will not pay. This results in lost revenue, and your agency absorbs the cost. Demand billing and payment protection. When properly issued, the ABN allows your agency to submit the claim to Medicare. If denied, the patient becomes financially responsible. This process is called demand billing. It protects your agency's right to collect payment. Always remember these ABN rules. The ABN must be issued before services are provided. The patient must choose their own option. A cost estimate must be included. The form must clearly explain why Medicare may not pay. ABNs cannot be used to correct agency errors. Ensure it is completed correctly to protect your agency. Another important rule to remember is that ABNs apply only to original Medicare, not Medicare Advantage plans. Understanding ABNs is essential to protecting your agency from financial loss and maintaining Medicare compliance. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.